All right, so you're moving to Canada. You've probably heard a lot about its world-famous healthcare, right? Well, that's only half the story. Today, we're going to build you an essential blueprint, a survival guide for one of Canada's most cherished, but also most complex systems. I mean, this is the core promise, isn't it? It's the big idea that draws so many people here. It's a powerful statement that's supposed to give you peace of mind, knowing you and your family are secure. This is the whole foundation of what's called Medicare. And here's where things get a little more complicated, because universal doesn't actually mean everything, and it definitely doesn't mean it's instant. You see, there's a gap between that big promise and the reality you're going to face in your first few months, and knowing how to bridge that gap is absolutely crucial. Okay, so here's the first big surprise for most people. Canada doesn't have one single national healthcare plan. No, it actually has 13 different systems, one for each province and territory. They all follow some federal rules, but they each have their own way of doing things. So what do they all cover? Well, at their core, they're all designed to handle the big, expensive stuff. We're talking doctor's appointments, trips to the emergency room, hospital stays, the catastrophic things. It's a safety net designed to make sure a serious illness won't bankrupt you. But, and this is the part that really catches newcomers off guard, let's talk about what's not covered. Things like getting your teeth cleaned, buying new glasses, picking up prescription drugs from the pharmacy, and get this, often even the ambulance ride to get to the hospital. All of that usually comes out of your own pocket or from private insurance. So how does this all work? Well, it's called a single-payer system. It sounds technical, but it's pretty simple. The government, that's the single payer, funds the whole system with our tax dollars. But the care itself, that's delivered by private doctors and hospitals, who are essentially independent businesses. And this brings us to probably the single most important point of this whole explainer. The healthcare you get, and just as important, when you get it, depends almost entirely on which province you decide to call home. So for any newcomer, this is the million-dollar question. Are you and your family protected from day one, or is there a dangerous waiting period where you're basically uninsured by the public system? The answer, as you're about to see, changes dramatically from place to place. And this just shows you how wild the difference can be. If you land in Alberta as a permanent resident, boom, you are covered from the day you arrive. But if you land just one province over, in British Columbia, you're looking at a strict 3-month waiting period with absolutely no public coverage. Now, let's take a closer look at this table. Zero in on that waiting period column. You can see provinces like Ontario and Alberta have your back immediately. But then you've got BC with that 3-month gap. And hey, look at Quebec. It's got its own unique flavor with a potential wait time and a mandatory drug insurance plan. And to make these differences even more real, let's just pull out this one number. So in British Columbia, if you're a temporary resident, like an international student, not only do you have to wait those 3 months, but then you have to pay about $75 a month for it. It's a pretty good reminder that free doesn't always mean free. Okay, so with all that in mind, what do you actually do? Let's turn all this information into a real action plan. This next part is your step-by-step guide for those first critical 90 days to make sure you get a healthy and financially safe start. And why is this so critical? Just look at this chart. Let's say you're in a province with a waiting period and you break your leg. That accident could easily cost you over $5,000. But with some simple private gap insurance, you'd be paying a much smaller deductible. The financial risk of being uninsured, even for a short time, is just enormous. So here it is, your 3-step action plan. Step 1, before you even get on the plane, if your province has a waiting period, buy private gap insurance. Step 2, in your very first week here, go apply for your provincial health card. And step 3, at the exact same time, get your name on a wait list for a family doctor. Don't put any of these off. And when you go to apply, what do you need to bring? It's pretty straightforward, really. You'll need your passport for ID and then your main immigration document. So your confirmation of permanent residence or a work permit that's good for at least 6 months. All right, now let's say you've got your health card. You're all set, right? Well, not exactly. Now we've got to talk about the long-term strategy, because successfully managing your health in Canada is about way more than just having that piece of plastic in your wallet. And this right here is the biggest long-term challenge. Over 6 million Canadians, that's more than the entire population of British Columbia, do not have a regular family doctor. This is a system that's under a lot of strain, and it means you have to be proactive. You can't just sit back and wait. So what's your strategy? First, get on those official provincial waitlists immediately. For day-to-day things like prescription refills or a sore throat, walk-in clinics are going to be your best friend. Also, definitely look into virtual care apps. They can be a lifesaver. And finally, use your network. Ask friends, colleagues, people in your community. That's often the best way to find someone. And remember all those gaps we talked about? Dental, vision, drugs? Well, this is how most Canadians cover them. When you're looking for a job, a benefits package isn't just some nice little perk. It's essential. This private insurance through your employer is the key to getting that comprehensive health coverage. So we've covered a whole lot of ground. Let's really lock in the key takeaways from your new healthcare blueprint. Look, if there's one thing to remember, it's this. Think of Canadian healthcare less like a free service and more like a partnership. The public system is amazing. It's an incredible safety net that's there to protect you from financial ruin. But it's your responsibility to plan for those waiting periods and to bridge all the other coverage gaps. So we'll just leave you with this final thought. You've probably spent months, maybe even years, planning your move to Canada, your job, your housing, everything. But have you put that same level of careful planning into your family's health? Because really, your new life depends on it.